Good morning. We are live with Dr. Reza Sharif and Heather Florio, and we're here today to talk about pain management and whole plant solutions, perhaps, to the pain management issue that so many people face. Chronic pain is a very real issue, and so is the opioid crisis. So I'm happy to have you both on the show today to offer your insights and wisdom into the pain management roadmap to going away from big pharma and more towards whole plant medicines. So Dr. Reza and Heather, thank you so much for being here.
Thank you for having us.
So I want to first start talking about pain management in general, like how as a society we currently manage pain. And I have a feeling, this is what so many people kind of closeted deal with, managing their pain and then realizing now that they feel some sort of addiction to the medication that they're on. So what are all the different pain management methods that are currently being used that y'all are looking at?
So perhaps I can start on this, if you don't mind, Heather. So pain management remains one of the challenges that we have in society. The annual costs associated with the treatment of pain, so just by itself, chronic pain would be associated with a reduced quality of life in patients. They end up being socially isolated. There is the advent of comorbidity factors like depression and anxiety, and many patients that have chronic pain and cannot find any way to manage it have also thoughts of suicide. So it is a very significant emotional burden on society. In addition to that, there is the financial cost of chronic pain. And so I'm talking about direct costs associated with chronic pain, such as drug medication, hospitalization, and the indirect costs, such as loss of wages, loss of workforce. So, in Canada, we're a smaller market, but if I give you numbers for the United States, we're talking about $600 billion annually that are lost in direct and indirect costs to chronic pain. There is not enough effective treatment, so these patients are left to suffer, and the lack of better treatment has indirectly led to the development of this opioid crisis that we have, which is now an epidemic at epidemic level. In Canada, we have 10 Canadians that die every day of opioid overdose, and right now the rate of opioid overdose deaths surpasses the heights of the HIV epidemics in the 1980s. This is how desperately we need new ways to manage the pain. And in terms of the costs that are associated with treating pain, this $600 billion, it's more than the costs related to cancer, diabetes, and cardiovascular diseases combined. Wow. So you combine all this, it's not enough to account for how much we're spending to treat chronic pain. So there's a desperate need for better ways to manage it, better analgesic strategies. So we need to come up with new ways to treat chronic pain. And many hopes lie on cannabinoids and to be able to use them for the treatment of chronic pain. And one last thing I just want to add very quickly for this question is that we have this misconception that chronic pain is a disease that happens in the elderly population, but this couldn't be further from the truth. We have young children that are born with juvenile arthritis, for example, and from age 2 they suffer from chronic pain. We have college students who in their first year start developing neuropathic pain symptoms overnight, and they have to change their entire life plan to accommodate this. Our war veterans, when they come back from their tours, they suffer from chronic pain as well, and we don't have ways to treat them. There's a lot that we don't know about the mechanisms that lead to chronic pain, and there's even less that we know on how to treat it without risking these side effects, such as the development of tolerance and addiction to those medications. One initiative that has been trying to bring light to the case of all these sufferers of chronic pain is a non-profit organization called the Invisible Project. And what they do is they put forward the different stories of the individuals that are suffering from chronic pain. This young lady, for example, Kelly Ruba, who was diagnosed with juvenile arthritis since age 2. She's now 40 years old. So for 38 years of her life, she had to cope with chronic pain without being to properly manage the pain. And this is the case for so many people that we need to bring more attention to the fact that there's very little out there for pain management. And we need to encourage governments to look at the data, encourage more scientists to do research on novel therapeutic strategies, such as the cannabinoids in this case.
Absolutely. And, there are some people in my life that they have addiction issues. And so when we do have the conversation about cannabinoid therapy being a potential method to pain management, their question and their concern is the lack of dosing. Like, the fact that they have to trust themselves to dose themselves is something that is frightening to them. So can understanding the relationship between cannabinoids and our bodies and our pain transmission pathway, can understanding that help us lead to medical style dosing for cannabinoids?
Absolutely, absolutely. So, the pain transmission pathway, as we'll talk about, can be broken down into 3 main parts. There's the peripheral nervous system; these are your pain fibers. And then there's central nervous system, which includes the spinal cord, where the sensory information arrives. And then there's the brain, which interprets the signal. And all 3 sites have cannabinoid receptors. So cannabinoids can act on any of those sites. It's possible that in some chronic pain conditions, the site of pathology is in the periphery, on those peripheral nerve fibers that are specialized in detecting pain. So better understanding this could mean that we can develop cannabinoid products that do not cross the blood-brain barrier, so that they cannot reach the brain, they don't reach the spinal cord, they only have their effect on those peripheral pain-sensitive fibers. The more we progress in research on this, the more we can come up with safer ways to treat, to use these cannabinoid drugs, and come up with better ways to find dosages for the patients. Yes.
That's outstanding. So, cannabis is a natural alternative to pharmaceuticals. And Heather, your company really focuses on natural alternatives, and Aloe Vera is the hero in in your wellness toolkit. So talk to us a little bit about those benefits of using aloe as an alternative.
So for us, 27 years ago, we developed our patented aloe vera formula that we still use today. We follow our aloe vera plants all the way from the field to where it's grown in volcanic soil. We're harvesting and processing within 20 minutes. If you've ever seen the aloe leaf in the grocery store, when it's cut off and it's sitting there, within 6 hours of cutting off an aloe leaf, all of the nutrients in an aloe plant are dead. There's malic acid that immediately begins eating up all of the nutrients in the aloe plant. So we have a patented process in which we are trying to preserve as much of those nutrients as possible, as fast as possible. And then we utilize a patented freeze drying process in which we filter all of the anthraquinones, which are latex chemicals naturally in the aloe vera plant that can act as an irritant to the colon. They can be they've been proven in research to be carcinogenic to the colon in long-term use, as well as they can also cause liver damage and kidney damage. We utilize a patented process that filters all of those out. Most aloes on the market have some anthraquinones in them. A lot of the times you'll see things like digestive aids, things like that. And this is kind of the difference with our product in that we process all of that out, all of the insoluble fiber. If you look at one of our 180 capsule bottles of our super strength aloe vera, it takes roughly 89 full grown aloe leaves to make one of those bottles. And so you're talking 89 of those just to make. So we go through a lot of aloe. And we developed this product originally back in 1993 for a bladder disorder called interstitial cystitis. About 80% women and about 20% men have no lining of their bladder. This is very debilitating, painful. You can imagine having your worst UTI, but having it never go away. So chronic, debilitating pain. You burning frequency, having to plan your life around where the nearest bathroom is, if you can even get far enough away to even leave your house. We've had a middle school, one of our customers has her daughter is a middle school girl. They had to make a toilet bed for her to literally sleep on, and she had no quality of life, could not go to school, could not do anything, and literally lived on the toilet. And our aloe capsules were able to return a normal teenager's quality of life to her. And so we have all of these interstitial cystitis patients, and some have comorbidities. They have other companion disorders in which fibromyalgia is a big one. We have a lot of arthritic patients. We have a lot of other autoimmune disorders and chronic pain conditions associated with interstitial cystitis. And as a result, we're trying to figure out how to help the whole patient when a doctor sends them to us. How can we go beyond that pain barrier? And so when we started going into research a few years ago, we wondered how we could combine cannabinoids with our aloe, and which way would be the most effective, which would be the most direct route that we could take. So we looked at different forms of CBD, full spectrum, broad spectrum, CBD isolate. We looked at topicals, we looked at ingestibles, we looked at a variety of things, and we found in our research that the most effective way was with combining the CBD isolate that we source with our patented aloe vera. In research, aloe vera has been proven to be a carrier for nutrients to help them be more systemic and bioavailable in the body. We actually create an entire supplement line, and each one has a little bit of aloe vera in them just to act as a carrier for nutrients so that your body wastes less and retains more, because typically your body, when you take a supplement, your body wastes probably roughly about 75% of what you ingest. It just wastes right back out. It's only going to retain what it needs. So we wanted to figure out, yeah, exactly. So we wanted to find out a way in which, because the cannabis plant in of itself is inert in the sense that it needs a carrier, it needs a vehicle to make it systemic in the body. That's where inhalation works, when you're, inhaling directly, or when you see edibles and they have what are essentially considered pharmaceutical enteric coatings or enteric ingredients that are essentially helping it process through the body to make it more systemic. And so that's where we thought, hey, what if we did this with our aloe? And so that's kind of what led us down this route.
So let's talk for a minute about the benefits of aloe in our body. So we know that CBD is going to increase the absorption of the aloe. So then now let's talk about what are those things that it's doing for our body so that people can understand, how all it's helping.
Well, so aloe vera in itself has over 200 nutrients naturally in the aloe plant, 75 of those roughly active nutrients. So you're talking vitamins, minerals, enzymes, antibacterials, antimicrobials, and so you're having all of these together, it's naturally an anti-inflammatory and an analgesic. And those are some of the two benefits. If you think about when you put aloe vera on a sunburn, it's reducing that redness and inflammation on the sunburn, and it's helping to kind of help speed the healing of that sunburn. And so in essence, it's those mucopolysaccharides that are naturally in the aloe vera. They are essentially a sugar chain. And those mucopolysaccharides, you want the highest content possible in your aloe vera to be the most effective.
And so they protect the lining of the bladder. So they create a coating around it. So that's why for IC, it's been so helpful, correct?
Yes, in studies, and we are actually getting ready to go into a new research study to study that more invasively and a little bit more further. But essentially, the theory goes is the gag lining that coats your bladder is made up of glycosaminoglycans, which are the same thing as the mucopolysaccharides, the glycosaminoglycans. These are theoretically, in a sense, creating that coating. Now, obviously, if you stop the aloe vera, that coating would go away. This isn't like, a permanent replacement kind of thing.
Certainly.
And so in theory, in our research is that it is creating that same coating. So it's having that coating is having that anti-inflammatory and analgesic action underneath while preventing and creating a coating, a barrier for any new introduction to any new potential irritants, acidities, things like that.
Got it. So you mentioned a study. Reza, why don't you talk to us about this current study underway with McGill University Research Center for Cannabis, examining the efficacy of cannabis for IC?
Right. So within McGill University, we have built a center for cannabis research, and we have scientists in all different aspects of cannabis research, going from agricultural science to airway, lungs, respiratory science, all the way to pain research, which is what we do. So when we were approached by Ms. Florio to study this, as scientists, we always have that curiosity to go and check whether this new drug will really improve the symptoms. So what we have built is a platform that allows us to do some preclinical screening. Essentially, when there are human chronic pain conditions, we try to build animal models of these pathologies, which are going to reproduce some of the symptoms that we see in the human condition. So, for example, there is a mouse model of interstitial cystitis, in which the animals have abdominal pain, they have increased urination frequency, and so on. And then we try different pharmacological treatment to see which one is able to attenuate or abolish those symptoms. And we have a few different models, some for interstitial cystitis, some for osteoarthritis, chemotherapy-induced hypersensitivity, and a few others. And what we proposed to do was to test this new combination of aloe vera and cannabidiol against these different preclinical models to see in which ones do we see a promising effect of this compound. So we tried it for example, on a model of neuropathic pain. So many patients have nerve injury, and after their nerve injury, they have a sensitization that takes place, whereby even if the injury has healed, they can still have chronic pain that can last for years after that initial injury. There's a mouse model for that, and we were able to test this formulation of aloe vera and cannabidiol. And what we saw was that the intensity of the pain that is experienced is significantly reduced when the animals are given this formulation treatment for 7 days. These are chronic pain models, so they can last for weeks. And then we make sure that we can see the development of the pain symptoms in these animals, and then we start treating them 7 days in a row with daily injections of this formulation, and then see how that improves the nature of the pain or intensity of the pain that we feel. And in many of these models that we tested, we saw that the treatment with cannabidiol, although it didn't reduce all of the symptoms, the pain that was being experienced was significantly reduced. Significantly meaning that we were surprised to see such a level of.
And so how, if we wanted to gauge that on a pain level where when we started the pain level was at a 10, I know we're dealing with animals, so how can you tell like where that pain level falls on the spectrum?
Right. So we have tests which allow us to quantify the intensity of that pain. Okay, so we can measure percentages of decrease in pain intensity. What we notice in many of those is probably around 40 to 50% decrease in the pain intensity when given. It varies, but around 30 to 50% decrease, which was very significant.
Yes, when you're in pain, 50% less would be wonderful.
Absolutely, absolutely. We saw that in neuropathic pain, in the interstitial cystitis, it was also very obvious. Like I said, these are models of the human condition, so some of the symptoms are present, not all, and then we try our treatment and we see which one of those symptoms have been attenuated. And in the model for interstitial cystitis, for example, there is a spontaneous pain that we can record from these animals, as well as just a general sensitivity around the abdominal area. If they're padded, we can tell that they are more sensitive. What we've noticed is that the spontaneous pain was decreased by 60%, if not more, which was very, very promising. The evoked pain, like from palpation or something like that, was decreased. It didn't reach the significance level, but there was a trend to almost 40% decrease. So in all cases, some aspect of the pain remain, but one of the most important one being the intensity of the pain that's experienced was significantly decreased when we treated the animals with this formulation. So it was very encouraging.
Now, are you doing the same study using different cannabinoids, or are we only focusing with CBD?
For the time being, we're only focusing on CBD and only focusing on this combination of aloe vera and CBD. So we essentially take the same pills that would have been given to humans, and we test it. We just dissolve powder and gave it to the animals.
So how far along in the study are you?
So the study was divided into two phases. Phase one was to see whether there was any promise in the preclinical models, and there was. So we just wrapped up that preclinical study. And what we're hoping to do now is to do something that's more translational. And by translational, I mean taking it from lab-based discovery and determining its relevance to the clinical setting, to the human population. And one thing that we have developed over the past 2 years or so is a platform for translational pain research. And we do this, we have built a team that's composed of surgeons in one of the nearby hospitals, the Shriners Hospitals for Children, and other scientists, and a provincial government body called Transplant Quebec. And essentially what we do is that we team up with these transplant organisms so that as soon as a donor is deceased, our team gets called as well, and we get in the operating room. We stand, against the wall first, and the organs that are meant for recipients are being harvested. But at the end, and in the past, when all the organs were taken, then the donor was essentially dead, and all the nervous tissue also die within that body. But at the time of transplant, the organs are still alive, including pain-sensing neurons in the periphery, including the spinal cord. So we have, built a questionnaire which we give to the family of the deceased donor to make sure that they agree with the use of those tissues for science. And what happens is that after the organs meant for transplantation are taken out, then the surgeon removes the sensory neurons and the spinal cord, and they give it to us. So we show up in the operating room with our solutions that are oxygenated, rich in nutrients, so that we can recover those nerve cells, and maintain them alive. We rush them back to our laboratory, and we can keep those neurons alive for up to 1 month, and they're completely healthy. And we can record their activity. We can see if they're excitable or not. These are ways that we can tell the activity of nerve cells. We record their electrical activity.
That's
And
fascinating.
yes, it is very exciting. And our training is electrophysiologists. We are neurophysiologists. So by having human pain-sensing neurons in a dish, now we can test if a compound that has shown promise in preclinical studies will actually have any analgesic effect. And by saying analgesic effect, I mean, will it be able to block the activity of pain-sensing neurons? Because this is the target tissue. You see, in the past 20 years or so, there hasn't been any major breakthrough in new medications for pain. And some of the possible reasons is that a lot of the preclinical studies from which big pharma launches clinical trials is based on rodent models, mice and rats. But it's possible that the species difference between the mice and the humans is so big that a compound may show promising results in the rodent studies, but then the physiology of the human being is so different that it loses this effect.
Yeah.
And now we have the I'll just take 5
No,
more
that's
seconds.
okay.
We have the tissue from the species that we want to treat. We have human pain neurons in our dish, so we can directly answer that question of, is this new formulation of cannabidiol in aloe vera efficient at blocking the activity of human pain sensing neurons? So this is the most direct question we can answer, short of running human clinical trials, which takes a lot longer.
Right. So I have a question. These pain neurons thing, this is exciting stuff to me. So there's all these different types of pain. Somebody can have like pins and needles, or a burning sensation, or like a sharp, severe pain. Are all of these same sensations going up and down these same neural pathways?
So a lot of our understanding goes hand in hand with technological developments. So there has been new techniques developed over the past few years, which allow us to isolate individual pain neurons and look at their genetic makeup. And what we've discovered is that there are quite many more types of pain-sensing neurons than we had initially thought. There are pain-sensing neurons that are specialized in detecting heat stimuli, and there are others that are specialized in detecting painful mechanical stimuli. And even within those large groups, there are subsets as well. And we're only beginning to tease out all the subtle differences between them, just genetically now. And the next step is to we work by ablation sometimes. So we remove one type of these pain neurons, and we look at what aspect of pain sensitivity has now been impaired. So, it's still ongoing, but yes, there are many types of pain sensing neurons. It's possible that many of them have specialized in detecting different types of pain, in the needles, heat, mechanical, like when you hit your toe on the foot of the bed. They all, could be activating different types of pain neurons.
Yes. So that's so cool. And so there's these 3 different places along this pain transmission pathway where you said we have cannabinoid receptors. I'm curious to know if different cannabinoids affect different receptors, or if, each of those 3 stops along the way, so to speak, are identical.
Right. So there are metabolites of cannabinoids too that can still bind receptors along the pain transmission pathway. That we know. Depending on where those receptors are located, you can have a different set of actions. So in the periphery, on pain-sensing neurons, we call them nociceptors, the pain-sensing neurons. So on these nociceptors, we have cannabinoid receptors, type 1 cannabinoid receptors, but we also have other receptors involved in pain transmission, such as the capsaicin receptor. This is the receptor that gets activated when you eat those hot chili peppers. And it turns out that some of the metabolites of the cannabinoids can act at this capsaicin receptor as well. But this is a receptor that we find predominantly in the periphery, not in the spinal cord or in the brain. So depending on where those receptors are located, yes, we can have different mechanisms of actions, and it's possible that the different types of cannabinoids that they produce may have a higher affinity for one receptor versus the other. The cannabinoid type 2 receptor, we find it more on immune cells, for example. And it could be that if one generates a cannabinoid compound that has a higher affinity for type 2 cannabinoid receptors, then its use would be more indicated for conditions with inflammatory conditions.
Yeah.
See?
This
So
is
there's a
so,
lot more to discover. There's a
yeah.
lot more to discover. And as we discover more, we find more ways to apply these cannabinoids.
So in your research of cannabinoids with pain management, what's like the coolest, most exciting / surprising thing that you've learned?
We get excited every day. So we weren't expecting to see this level of analgesia. And you see, because these cannabinoids can act also on the brain, when we do tests on mice, we have to rely on their behavior. So there are behaviors that are indicative of a painful reaction, but we can't ask them that question. And sometimes the problem in the interpretation is that maybe that cannabinoid drug just had some motor effects, motor impairments. They're just ataxic. They're just groggy. It's not like they don't feel less pain. It's just that they find it harder to move. So it's always important to control for these experiments with motor tasks. So in our case, when we give them these compounds, these cannabinoid formulation, we make them do motor tasks to make sure that there's no motor coordination deficits. And one of my fear was that these analgesic effect that we're seeing could be due to an impact on their motor coordination. Maybe they're just less mobile now. But it wasn't the case. When we tested them, their mobility was untouched. They were completely fine.
That's
All I
outstanding.
would say is that we still need to do some studies on alertness. Because there was a study done at McGill where they tested university students on visual acuity in a driving simulation test, just to make sure that for how long after are they still prone to making mistakes like that require rapid reaction times. So it's important that as we progress in this direction, that we also make sure that it's done safely, which the industry of cannabis being always under the microscope from government official, luckily for everybody, is progressing in a very cautious manner.
Certainly, that's because we're moving in on big pharma, and they line the pockets of government. That's why everybody's so scared. Plant medicine has been hidden for so long, and I love that there are groups doing studies like this, and I'm happy to give you a voice. So, Heather, you do already have this Aloe CBD line on the market through your company, Desert Harvest. What are some of the people that are consuming this product? What kind of feedback are you getting?
Limited, obviously, we go to government as to what I can say. We do we've gotten very good feedback. We just introduced this in June of this year. We had been in formulation, like I had said, for many, many years, and we actually did a study at the University of Colorado IC4 lab to determine that our product was actually, we wanted to prove that it was, the aloe was going to make it more bioavailable, more systemic in the system. And so we did do that, and we were able to prove that it was 25% more absorbent than other CBDs out on the market, and more systemic and bioavailable in the system. And so we were really excited about that, which then led us into being able, we wanted to determine what types of pain it was most effective for. So that is why, I sought out Dr. Sharif specifically, because I knew about his research, his pain research, and I wanted to be able to work with him to determine. So we're looking with our Desert Harvest CBD, we're looking at, like Dr. Sharif had mentioned, at these different clinical models, not just interstitial cystitis, but we're looking at arthritic pain, we're looking at neuropathic nerve injury pain, chemotherapy-induced pain. So, we're going to be looking at other things, surgical pain. We're looking at a variety of different clinical models to determine what types of pain this is most effective for, because we want to be able to tell our consumer base, this is what it's going to be good for, this is not what it's good for, this is how much you should dose based on this is how much you should dose. And so we wanted to be able to have all of that clinical data to be able to tell. I will say that we have had very happy customers since we introduced it in June. When I created this product, I created it because of my husband. He was in the US military and had gotten injured and lost the ability to walk. And he, due to nerve and spinal damage, and they were able to repair the spinal damage to a point, but they were not, and make him to be able to walk again. But unfortunately, he experienced chronic pain on a daily basis where, I'm having to take care of daily needs of certain things for him and stuff like that. And so it became a situation where someone you love and you watch struggle on a daily basis, when there could be options out there. And so we started looking into different things, and that's where we started looking into all different types of cannabis and other type products. And that is where I came up with this specifically, because I wanted to be able to, like, my husband is all like, you can never stop making this product ever, ever, ever again. And I want to be able to help other people like that. The way I've been able to create this for my husband, I want to be able to help just as many people, but I want to do it in a responsible way, in a way in which I'm not just going to say, oh, it works for this and it works for that. I'm going to determine scientifically with Dr. Sharif what this is going to be effective for, what it's going to work for, and who it's going to help, and at what dosage.
Well, I love that. Thank you for doing this and putting the time and energy behind the research, because that's so important, especially now with us trying to move into a legal cannabis market. We need, as much data as possible on our side. So thank you both for the work you're doing. Reza, I know you were out of time with you.
I still have a few minutes. I just wanted to make one comment, if you allow me.
Yes.
And I'm a scientist, and scientists are, I guess, leaning more towards social system, where we want the results of our findings to really benefit everybody. As a pain scientist, when I see the large population of people that suffer from chronic pain, my priority is that remedies be out there for them. I cannot say, I'm not in a position to say these discoveries, these developments should not be made by big pharma or smaller companies, like Desert Harvest or, individual plant growers. At the end of the day, we need partners to help us make these discoveries, and whoever they be, if we can get big pharma interested in the cannabis industry, anything that can accelerate the delivery of these new treatment options for the patients, for me is something that's valuable. I'm not in a position to judge about the politics around this, and I don't want this to be around politics. What I'm saying is that my priority is that you get something out to the patients. That's the most important.
Absolutely. Absolutely. You're doing all the right things. I appreciate you.
Thank you.
Absolutely. Well, I've appreciated your time. If there's anything else that maybe we didn't talk about that you think it's important to add to this dialogue before we wrap. Everybody good?
I think we are good. I think we've pretty much covered. Can I do a shameless plug? You can also visit our website at desertharvest.com. Shameless plug.
All right, desertharvest.com. And aloe is something that I use every morning. It's part of my Aging Gracefully toolbox. I put it all over my face and my arms and my neck and all that stuff first thing before I get ready for the day. And I've got super sensitive skin, so I'm fresh-faced for you today. I have aloe and CeraVe on this morning. But yes, aloe is good for so many things. I mean, I know we're talking about aloe and CBD for pain management, but those are two things that people should consume every day anyway.
Yes.
Like the antioxidant benefits of CBD and it's all goodness. So
It is. And as we rush to, things natural, the only thing I can say is do your research when you're researching your products, researching what you do, because like I mentioned about the anthraquinones and the aloe, just because a product is sold on the market, just because it's out there and it's an ingredient and it's natural, there's no guarantee that it's safe for what you want to use it for. So always, when you want to add a supplement to your regimen, follow up with your doctor. Skincare makes it much easier. That one, we do a whole line of skincare. Like we have our Relivium, which is for radiation dermatitis for cancer patients undergoing radiation treatments, all natural except for the 4% lidocaine. We have like what you would use as a daily moisturizer on your face, things like that. We do cater to that as well, but just skincare is obviously a little bit easier, except for we get into the whole fake aloe situation, and that's a story for another day. But there was a Bloomberg investigation done in 2016, and they found that all of the aloe vera product it sold on CVS and Walgreens shelves and stuff like that contained absolutely no aloe, because aloe in HPLC tests can actually mimic mucopolysaccharides, or maltodextrin can actually mimic the mucopolysaccharides, the nutrients in the aloe, and so it can be a fake thing. So just be very, know your brand, trust your brand, do your research. Just because it's natural may not necessarily be safe, and look into, you are your own best advocate. So
absolutely, buyer beware. Yep. All right, guys, thanks for hanging out.
Thank you.